everyone, Nicolette here. So I have come on to help you study for the NCLEX. And one of the most important things to do when you're studying for the NCLEX is for you to read your NCLEX book. Whatever NCLEX book you decide to go through, you have to read it from cover to cover. That is a must. So take the time to pick an NCLEX book and then take the time to sit down and read it. Okay, so let's say you're not interested, you don't have time, I'm going to do it for you. So today I'm going to cover NCLEX RN Chapter 5, where it talks about the care of special populations. Okay, so listen carefully as I read, and I will come back later on and explain some of the key pointers. But for now, just listen. Okay, here we go. Priority contacts. Oh, by the way, this is NCLEX RN from the Saunders book. This is the one that I prefer, but you could pick whichever one you like, wherever you want to purchase it. I got mine from Barnes & Nobles. Just select a book and read it through. Here we go. If you want to follow along, go ahead and grab that Saunders NCLEX book. Priority concepts. Caregiving health disparities. Special population groups. The literature identifies numerous groups that may be designated as a special population group. But for this chapter, the authors have identified certain special groups that would most commonly be encountered in the healthcare environment and require sensitivity regarding their healthcare needs. Vulnerable groups typically experience health disparities and inequalities and include people of color, those who are uninsured, those living in poverty or homeless, those with chronic illness or disabilities, immigrants, refugees, those with limited English proficiency, those who are incarcerated, and members of the LGBTQ, lesbian, gay, bisexual, transgender, queer, or questioning community. So in this book, box 5-1, you'll see a list of the special populations. You can also see box 5-2 for a comprehensive nursing assessment tool written by the authors of this chapter titled Special Population Needs Assessment Tool that can be used to obtain information from the client about his or her special needs in order to plan care. This tool can be adapted based on the individual being cared for. Healthcare providers' self-awareness of their own culture, values, beliefs, ethics, personality, and communication style promotes optimal health outcomes for clients of diverse cultures. Recognizing one's own biases or prejudices and being respectful to all people despite differences can influence satisfaction of care. It continues to say, it is imperative for healthcare providers to understand that cultural groups share dominant characteristics. However, subcultures exist and stereotyping must be avoided. Racial and ethical minorities. Due to the increasing diversity of the United States population, minorities are projected to become the majority. Racial and ethnic minorities are affected more often than their white counterparts by healthcare disparities and inequalities. Social determinants of health are conditions in which persons are born, grow, live, work, and age, including the healthcare system, and are correlated with health and health inequalities or inequities. Cultural competence is a necessary ability for healthcare professionals to provide care for a diverse population and can help improve health outcomes and quality of care. Family members and friends should not be asked to be an interpreter for the client because of confidentiality. the potential for conflict of interest, and the risks associated with relaying inaccurate information. Only specified individuals are designated by the healthcare agency should be asked to interpret for clients. Definitely remember this one, that you cannot use a family member or someone who is related to the patient that might, change whatever information you want to relay. You need to find someone who is designated as a healthcare, by a healthcare agency in order to be an interpreter. That is going to be an exam for sure. Return explanation and demonstration, teach back, are of particular importance when working with clients of various backgrounds to ensure safety and mutual understanding. That is also a very important point. This is that follow-up that they might also phrase the information that way, making sure that the patient understands. In order to do that, have them repeat it to you. Description and population-based risk factors. African Americans or Blacks. This population has origins in Africa and the Caribbean. Some in this population may be less likely to have health insurance coverage or a regular source of health care. Nearly 50% of adults have chronic health conditions. For additional information, refer to, and it gives you the link, obesity, diabetes mellitus, hypertension, heart disease, asthma, and cancer are prevalent amongst this population. I have seen questions on this bullet point here, so make sure you remember this, especially with the diabetes mellitus and hypertension. I have seen them mention Blacks who are more prone to having this disease. So remember, obesity, diabetes mellitus, hypertension, heart disease, asthma, and cancer are prevalent among this population. Remember that. Some leading causes of death among this population are heart disease, cancer, and stroke. Hispanics, Latinos. This population has origins in Mexico, Puerto Rico, Canada, South or Central America, or other Spanish culture or origin. Multiple subcultures have unique practices and behaviors. Providers must avoid stereotyping to ensure the delivery of cultural competence care. Multiple subcultures have unique practices and behaviors. Providers must avoid stereotyping to ensure the delivery of culturally competent care to optimize health outcomes. Some in this population may not have health insurance coverage or a regular source of health care. Language barriers and lack of access to preventative care influence health. Approximately 35% of adults have chronic health conditions. For additional information, refer to, and it gives you the link. Lack routine health care and delay seeking health care for illness are common. Obesity, diabetes, end-stage renal disease, secondary to diabetes, and cervical cancer are prevalent amongst this population. Some leading causes of death among this population are heart disease, cancer, and accidents. Important health topics include, but are not limited to, discussions surrounding diet and meal plans, exercise, and safe sex practices. Native Hawaiian, or other Pacific Islanders. This population has origins in the Pacific Islands, including Polynesia, Micronesia, and Melanesia. This population is noted to have higher risk of smoking, alcohol consumption, obesity, and diabetes mellitus. Note this bullet point here. I've seen a lot of questions on the fact that this population has a high rate of alcohol consumption. I've seen that question a lot. Also smoking, but mostly alcohol consumption. Next leading cause of death. Some leading causes of death among this population are cancer, heart disease, accidents, smokes, stroke, and diabetes. There is a high incidence of infant mortality and sudden infant death syndrome, SIDS. Hepatitis B, human immunodeficiency virus, HIV, and acquired immunodeficiency syndrome, AIDS, and tuberculosis are other diseases prevalent among this population. American Indians and Alaska Natives. This population has origins in North, Central, and South America and have tribal or community attachments. Some in this population may not have health insurance coverage or a regular source of health care. Cultural barriers, geographic isolation, and low income prevent this population from receiving quality health care. Smoking is a common practice. Nearly 1/3 of this population older than age 18 years smokes, and some consume alcohol in large amounts. This population is noted to have higher incidence of diabetes mellitus and stroke. Some leading cause of death among this population are heart disease, cancer, malignant neoplasm, cerebral vascular disease, and accidents. This population is at risk for altered mental health, suicide, sudden infant death syndrome, SIDS, teenage pregnancy, liver disease, and hepatitis. There is a high incidence of infant mortality. Asian American is the next group. This population has origin in Eastern Europe, Eurasia, South Asia, or Southeast Asia, or the Indian subcontinent. This population is disproportionately noted to have different types of cancer, tuberculosis, and hepatitis. Some leading causes of death among this population are cancer, heart disease, and stroke. Some older Asian American women are at an increased risk for suicide. Healthcare considerations for racial and ethnic minorities. Cultural competence is a mainstay in the effort to reduce racial and ethical healthcare disparity. The nurse and other healthcare professionals should be trained in healthcare variations and risk factors for various populations in order to facilitate access to needed healthcare services. It is important for the nurse to examine his or her own cultural preferences in order to competently care for someone of a differing culture. Emotional intelligence is a usual tool in caring for these special populations. Knowledge of the various racial and ethnic groups in terms of cultural preferences, health risks, and health preferences is needed to deliver culturally competent health care. Lesbian, gay, bisexual, transgender, and queer are questioning individuals. Commonly referred to as the LGBTQ community, this group is represented by a wide range of varying characteristics in terms of race, ethnicity, age, socioeconomic status, and identity. Unfortunately, stigma and discrimination is a reason for their identification as a special population. Often, there is a lack of awareness and understanding among healthcare professionals in managing the healthcare needs of this population. Therefore, access to healthcare to meet their needs is less compared with other population groups. Description. The term sexual orientation is an encompassing term used to describe a person's behavior, identity, and desire. A variety of words may be used to describe sexual orientation, including men who have sex with men, MSM, women who have sex with women, WSW, or gay, lesbian, asexual, bisexual, pansexual, queer, or same-gender loving. The term transgender is used to describe individuals who do not identify as a person with their birth sex. Other terms to describe transgender individuals include male to female, MTF, female to male, FTM. For additional information, refer to GLAAD Media Reference Guide, Transgender, and they give you the link. Important research is needed with regard to the healthcare needs of various gender identities. Using the preferred pronoun when addressing these clients is important in developing and maintaining a rapport. Risk factors. Some LGBTQ persons may be less likely to access health care than other population groups due to stigmatization and fear of being viewed as different. There are no health disparities especially associated with this population as a group. However, there are members within this population who experience inequity in healthcare management due to a variety of other factors. Some in this group may not have health insurance. Transgender individuals may be less likely than other groups to have certain screening completed, such as mammograms, breast exams, cervical cancer screening, testicular cancer screening, and prostate screening. Sexual transmitted infections are of concern in this population. HIV and AIDS are more prevalent among certain members of this group, particularly MSM and MTF transgender persons. Additionally, syphilis and gonorrhea, human papillomavirus HPV, and anal cancer rates are higher among this population. Lesbians are more likely to be overweight or obese. Gay and bisexual men may be more likely to have eating disorders and body image disorders. Breast cancer and cervical cancer rates tend to be higher among lesbian and bisexual women, likely a result of decreased screening in nulliparity and nulliparity. The LGBT population is more likely to smoke than other population groups. Additionally, alcohol and drug abuse may be more common in some individuals. Depression and suicide rates tend to be higher in this group than other population groups. Rejection from friends, family members, and social support systems may be a stressor. Teenage members of the LGBT population are more likely to be threatened, bullied, injured, raped, and victimized. For these reasons, school absenteeism can be a problem. LGBTQ youth are at risk for physical abuse by family members due to their sexual orientation. Many same-sex couples desire children. There may be some barriers to child rearing for this population, such as the expenses associated with adoption, artificial insemination, and surrogacy. Health promotion measures should focus on depression screening, assessing for suicide, educating on safe sex practices, and counseling for alcohol and drug use. Healthcare considerations for the LGBT population. Healthcare professionals need to create a welcoming, non-judgmental environment when caring for this population. Measures such as altering signage on paperwork, such as documents asking for gender identification, will better serve the health needs of this population. Additionally, the healthcare facility should develop institutional policies inclusive of all gender identities and preferences. Some measures will allow the healthcare providers to treat the clients according to their preferences while also maintaining an understanding of their risk factors based on biological drivers of health. Training to work respectfully with the LGBTQ population should be provided for all healthcare personnel. Use of open-ended questions and refraining from making judgments during client encounters are important. Health promotion measures should focus on screening for depression, assessing for suicide, and educating on safe sex practices. Additional screening within this population should include HIV blood testing, syphilis blood testing, urine, Neisseria, gonorrhea, and anal chlamydia trachomatis for those with insertive intercourse in the last year, rectal and gonorrhea, and C. trichomonas for those with receptive anal intercourse in the last year, and pharyngeal and gonorrhea for those with receptive oral intercourse in the last year. Hepatitis A vaccination is recommended for MSM. Anoscope should be used to examine the anus and rectum as indicated, with particular attention paid to those infected with HIV. Mammography and cervical cancer screening should be initiated for lesbian and bisexual women. A careful sexual history and appropriate counseling is important for all members of the LGBTQ population. Non-occupational post-exposure prophylaxis and PEP, or the use of prophylactic antiretrovirals before and after potential HIV exposure, should be initiated. Transgender persons taking hormone therapy need to be monitored at regular intervals. Associated complications such as polycythemia occurring with exogenous testosterone use should be detected and treated early. Transgender persons who have undergone sexual reassignment surgery should have the respective preventative screenings. For example, MTF should have breast cancer screening by way of mammography if they are older than 50 years old. Additionally, FTM should still have mammography routinely as indicated due to the risk of residual breast tissue to develop cancerous growth. So we're going to stop here for now, and I will see you guys next time as we continue on this topic. We will be seeing the homeless population next. See you next time. Bye. Keep studying.